The U.S. is in the eye of the hurricane right now, according to health experts. After months of devastation, it appeared things were heading in the right direction, with officials reporting several weeks of steep declines in COVID-19 cases. But now case declines have stopped, and infection numbers are jumping. Governors are dropping mask mandates. Spring break is underway, and experts project the country is about to see another dangerous COVID-19 spike. Joining me on the morning show is Dr. Jonathan Kantor, an epidemiologist with the Penn Center for Epidemiology. So, given that information, how concerned are you right now that we're on the precipice of another big spike?
Well, I think everyone's concerned. One thing that we have learned, of course, from the pandemic is that we don't know what's going to happen, and we can't predict how things are going to go. So I think that's part of the challenge here, is really trying to figure out what direction things are going to happen. At the same time, the other thing that we've learned is that we have to be very, very cautious, and we have to realize that, if we always accept the best possible case scenario, that ends up in a dangerous situation. So we really have to focus on what needs to be done and what we are going to do, because that way people are as cautious and as careful as possible. And so that's why it's always good to err on the side of caution. That doesn't mean we panic. That doesn't mean we stop doing the things that are important, but it means that we're smart about them.
So is the biggest unknown, the biggest concern, those COVID variants, some of which spread more quickly than the original form of COVID? In fact, I think one of the variants out there spreads like 74% more quickly than the original.
Yeah, definitely the variants are a major concern. We've been seeing a lot of that going on. We've been seeing a massive increase in terms of the United States, what we've been seeing in terms of variants, and keeping those variants under control and reducing the amount of problems that we have associated with that is going to be critical. That's why the vaccination is so important, because we're in a race essentially against these variants. These variants are replicating quickly, and the more we can kind of stop the spread of COVID, the more we can stop the spread of those variants. Because those variants potentially mean that there's an increased risk of spread, potentially even mean an increased risk of death, and potentially also mean that the vaccines won't be as effective, it's particularly important for that vaccine rollout to be as smooth as possible and for people to be as accepting as possible of the vaccine as well.
That said, we can get a bit of our lives back. CDC issued some new guidelines for people who are fully vaccinated. Bottom line is people who are fully vaccinated can safely visit others who are fully vaccinated in some circumstances, but there are still safety precautions to be mindful of here. So what are your biggest takeaways from what we heard from the CDC?
Yeah, this was very exciting. On a practical level, the problem was that people were getting vaccinated when it was just one person in the family or one person who doesn't know anyone else getting vaccinated. It didn't have major implications. But now that you're getting these little pods of people who are all vaccinated, they want to know, what can we be doing safely? Should we be having a dinner party together? Do we need to be wearing a mask when we're, at our family's house? Can grandparents be visiting grandchildren? All those questions. So the CDC attempted to clarify some of this. Of course, questions still remain, but they at least clarified it in the sense of saying, listen, and it's sort of what people would have thought all along, is that if everyone in the group has been vaccinated, it's probably okay to hang out indoors together with no masks. If you are hanging out with people who are at low risk, that may be acceptable as well, but you have to be aware of that risk and you be willing to accept that risk. So, the take-home point is sort of basically codifying what people were going to be doing anyway. But I think it is important for the CDC to be looking forward like this and to be giving guidance, because that's the other thing is that, I see this when I talk to my patients. A lot of them are older, they've been vaccinated, but they're also saying to me, hey, wait a minute, I want to be doing the right thing for those around me. I want to be doing the right thing for my kids. And so that grandkids. So that's why it's so important. And the other key takeaway is that even if you've been vaccinated, when you're in public, you have to act as if you haven't been vaccinated. So mask up, social distance, and all those things as well.
And that'll help with some of the mental stresses too. And quickly, there's a new COVID treatment pill in development by Merck. It's early phase, kind of like Tamiflu for COVID. You think it could be a game changer?
Well, they're definitely hoping it can be. We only have the very preliminary data out there on molnupiravir, suggesting that it did result in viral clearance, which is fantastic. But that's only one endpoint, right? So does it clear you from the virus? So it's going to be very interesting to see the clinical outcomes of this as a phase 2A study. It'll be interesting to see those outcomes. Again, number 1, 2, and 3 is still going to be vaccination, but absolutely for those cases that slip through, it is going to be critical to have other options out there. And so it's very promising to see anything that is effective, and particularly something that's effective that does not have a dramatic side effect profile.
Dr. Kantor, clearer view of what may lie ahead when it comes to COVID, and clearer skies lying ahead when we head toward the weekend with the weather. Thanks.